Hay fever, also known as allergic rhinitis, is a common condition that can make you feel like you have a constant cold. Symptoms include a runny nose, sneezing, itchy eyes, congestion, and sinus pressure. Unlike a cold, hay fever isn't caused by a virus. Instead, it's triggered by your immune system reacting to harmless substances in the environment, such as pollen, dust mites, or pet dander. These allergens can be found both indoors and outdoors, and your body mistakenly identifies them as threats. As a result, you experience those familiar allergy symptoms. Hay fever can impact your daily life, making it harder to focus at work or school and even affecting your sleep. But understanding what causes hay fever is the first step toward managing it and finding relief. Hay fever symptoms can vary from person to person, but the most common ones include a runny or stuffy nose, watery and itchy eyes, sneezing, coughing, and an itchy throat or roof of the mouth. Some people also experience postnasal drip, dark circles under the eyes, and fatigue due to poor sleep. The triggers for hay fever are just as varied. Seasonal allergies are often caused by tree pollen in early spring, grass pollen in late spring and summer, and ragweed pollen in the fall. Year-round triggers include dust mites, cockroach droppings, pet dander, and mold spores. It's important to note that hay fever symptoms can be mistaken for a common cold, but there are key differences, such as the absence of a fever and the immediate onset of symptoms after exposure to allergens. The root cause of hay fever lies in your immune system's response to allergens. When you inhale or come into contact with an allergen, your body produces antibodies called immunoglobulin E, IgE. These antibodies signal your immune system to release chemicals like histamine, which cause the classic allergy symptoms. Certain factors can increase your risk of developing hay fever. These include having other allergies or asthma, a family history of allergies, living or working in environments with high allergen exposure, or having skin conditions like eczema. Exposure to smoke, strong odors, or even having a mother who smoked during your first year of life can also raise your risk. Understanding these causes and risk factors can help you take steps to reduce your exposure and manage symptoms more effectively. If left unmanaged, hay fever can lead to several complications. It can reduce your quality of life by interfering with daily activities and productivity, and it often causes poor sleep, leading to fatigue and malaise. For people with asthma, hay fever can worsen symptoms like coughing and wheezing. Prolonged congestion may increase the risk of sinus infections, and in children, hay fever can contribute to middle ear infections. While there's no way to completely prevent hay fever, you can minimize symptoms by reducing exposure to known allergens. This might mean keeping windows closed during high pollen seasons, using air filters, or taking allergy medications as recommended by your healthcare provider. Early management and prevention strategies can help you stay comfortable and maintain your daily routine.